So normal, healthy, young people are being affected and are dying from this virus. People are, the naysayers are like, oh no, this is hype. No, it's not hype. It's real and it's happening. Patients who have other comorbidities, such as cancer, heart disease, kidney disease, other disorders, they're going to be primarily more affected. But that's not to say that the healthy population isn't being affected as well, and are coming away with things that they didn't have before the virus. And so what these clots are causing, it's causing, in children, in pediatrics. So let's just move on to the pediatrics.
So children are getting this as well.
Yeah, children are getting what they're calling multi-system inflammatory syndrome. And that's characterized by a persistent fever, inflammation, poor function in one or more of their organs, and other symptoms that resemble shock. In some cases, these children, they're having what's called Kawasaki disease. And Kawasaki disease involves the inflammation in the walls of the medium-sized arteries. Again, same thing, that can damage the heart. So we're seeing this more in children now. It also causes that immunoresponse that I talked about in adults. What's also prevalent in, we're seeing it in children, and it's called, what they call it is a cytokine storm. And that, again, it's a severe immune reaction where the body releases too many cytokines. That means that the body is trying to fight off the virus. So it's sending out all of these helper T cells and different types of cells to attack the virus, but it's sending too many, and the body is reacting negatively to the good things that are trying to fight off the virus, which is causing this inflammation process, and which is, this is what's causing a lot of damage: heart, lung, kidney, your vital organ damage in children, in adults. So there's actually another also less reported, but we're seeing more of this. It's called COVID toes, like toes on your feet, that patients are also reporting that their toes are swelling, like purple, red. Again, we're surmising, these are blood clots, but it's less damaging, but nonetheless, this is another side effect that we're starting to see. I'm seeing other things. It's kind of crazy because this virus acts almost to me like a little bit like sickle cell anemia in some respects. It's also acting a little bit like malaria. So it has these really odd components to it that are causing things that we're just now starting to recognize. And we're actually involved in the Mayo Clinic study. All of our patients, we're doing convalescent plasma as part of a treatment. There is, Emory, we're working in conjunction with Emory to take a look at the drug that, again, these are not cures. They're tools for the tool belt to combat. So all of our patients, when they're diagnosed now with COVID, they have to be on blood thinners. There's a battery of things that we're treating these patients with to kind of combat all of these symptoms. Some of it being ventilators, some of it being antibiotics, some of it being, convalescent plasma. And that holds, so the convalescent plasma is given from patients who have survived COVID and are now donating their plasma because they've built up some form of antibodies. But again, because there are multiple strains of this virus, some antibodies are more prevalent than others. It also depends on what kind of a viral load the patient received, which is why we don't really know, can we catch it again after we've had it once? You know, we don't know. We simply don't have the answers to that right now.